We're looking forward to hearing about the forgotten generation, adolescents and the obesity crisis. Professor Mark Hanson.
The obesity epidemic is increasing in leaps and bounds. And the sad truth is that we are not addressing it by the interventions that are there at the moment, whether it's interventions in adult lifestyle or searching for genes which somehow link to risk of obesity. We have to have a new approach. Obviously, we could get funding and wait for years to do randomized controlled trials, the gold standard of little interventions here and subtle tweaks there. But actually, the kinds of things that we need to do, we all know about. It's not rocket science. It's improving education, it's improving healthy diets, it's improving access to physical education facilities, it's promoting healthy sleep patterns and reducing stress, stopping smoking, reducing exposure to alcohol. I could go on and on. No parent would be surprised by this list. We don't need to do research to show that these things are important. What we need to do is to find ways of engaging young people in a program that allows us to change them.
For the first time, really thinking hard about non-communicable diseases through prevention. So when's the prevention going to start?
LifeLab is undoubtedly improving knowledge and awareness of the health issues in young people. What we're not so sure is whether that will be translated into changes in behaviour. And I think this is where LifeLab is part of a growing social movement that young people need to engage with. That perhaps will lead to changes in the services and the opportunities that are provided for them through advocacy, through the initiatives in policy formation and implementation that we're also engaged with the government in this country. It's a combination, I always think, of a bottom-up, demand-driven kind of approach and a top-down, supply-driven approach. And perhaps by bringing those together and making young people at the centre of that interaction, we can find a new way of helping them to promote healthy behaviours and sustain a better future for themselves and their kids.